Hey, welcome to Socialism for All. Today's date is January 18, 2022. In this video, we're going to take a look at a Politico article titled Walensky Faces CDC Burnout as Pandemic Enters Third Year. Yeah, poor CDC. I'm sure they're the only ones facing burnout. Meanwhile, they won't even recommend, let alone mandate, N95 masks. I think we're all pretty sick of the pandemic. And in fact, if they had not told people to take their masks off, for example, last May, maybe the spread wouldn't be as bad as it is. Do I sound angry and bitter? I am. Really. I don't think anyone wants to be entering the third calendar year. The drain on all of our lives, I mean, whether we've lost loved ones, whether we've gotten sick ourselves, whether we have suffered major life disruptions from this entire process. Just can we get this thing under control already and stop half-assing it in the most supreme way? So anyway, in this article, we get an inside look at some of the stuff that's been going on inside the CDC. Stick around because there's some really interesting stuff in here. One of the ones for me, I mean, I made videos back in May 2021 when I was like, why are they telling people to take their masks off? This is crazy. It gets better because apparently they were about to dismantle their pandemic task force, period, right before Omicron hit. So that's the level of not wanting to deal with this that the CDC is at and the people who they work for, the capitalist class. Anyway, the tagline on the article is, "Inside the agency, a race is taking place. Can it stop the spread of COVID-19? Is it even trying before its staff wears out from exhaustion?" Again, it's like the U.S. has just abandoned the fight against COVID. And things will not go well when you have something like COVID, this highly transmissible, now with Omicron, extremely transmissible, airborne virus. And you're not even telling people to wear masks. That's going to go real badly. So this article was written by Aaron Banco, and the date is January 15, 2022. Let's get into it. In an early December call, Rochelle Walensky, director of Centers for Disease Control and Prevention, and just literally they're not controlling or preventing COVID right now, but okay, greeted a weary staff facing an ominous new chapter in the pandemic response. The Omicron variant was spreading rapidly, she said, leading to increases in cases and hospitalizations, an indication that the U.S. was in for another difficult winter. Comment. A difficult winter, that's entirely predictable. People are indoors with windows shut because it's cold out. You don't want to be letting cold air in. What does that mean? It means that the virus is recirculating in the air more. We saw a huge spike in cases last winter. That was entirely predictable, even without Omicron. Even without Omicron, that was entirely predictable. But now with Omicron, all the more so. Continuing. And employees of the agency's Pandemic Response Team, some of whom have worked on the CDC's COVID-19 efforts since January 2020, had reached their breaking point. For more than a year, CDC scientists and officials have reported extreme burnout, and the virus pushed them to complete investigations quicker than ever. In the all-hands meeting, Walensky delivered a sobering message to her employees. The workload was about to ramp up again. She urged CDC individuals who had not served on the response to step up to help. Quote, "It was a pep talk," one CDC staff member on the call said. The message was, "We know this is tough, but we have to keep going." And I just have to ask here, is anyone inside of this going, our policies aren't fucking working? Is anyone, is there some kind of revolt inside the CDC? It doesn't sound like it. I don't know how anyone working in public health could be happy with the kind of policies that the U.S. has been doing. I don't know how anyone who knows epidemiology could be happy with this. It's obscene. To many of those listening, the call was a stark reminder that despite their best efforts, which best efforts? To contain the virus, the pandemic was not over. In fact, as I said in the video, it may just be beginning. And that the crushing workload would continue. Although reports of fatigue among members of the CDC's pandemic response team are similar to those expressed by millions of healthcare workers across the country, the agency is in charge of safeguarding the entire country and the burnout scientists feel impacts their ability to help to curb the pandemic. Okay, so I would personally like to strip the credentials from every person who signed off on the "if you're vaccinated, you can take your mask off." Those people are to blame for a lot of the situation. Period. They are to blame. Now, I don't believe that any epidemiologist, any infectious disease person really can look at that kind of a policy and say, oh, that makes sense, when we know that vaccinated people can spread. Yes, get the vaccine. It helps to protect you against the worst outcomes of COVID if you get it. But it doesn't really do that much for transmission. So the whole "if you're vaccinated, you don't have to wear a mask," every single person who signed off on that is to blame for what's happening now. And every PhD in epidemiology, every MD who's also an MPH, every MS in public health, whatever it is, anybody adjacent to the entire study of controlling diseases at a public, population level, who contributed to or signed off on these totally ludicrous and destined to fail policies should have their credentials stripped. They should be laughing stocks. They should never be allowed to work in this field again. Okay. Just months earlier, Walensky and other top officials had a plan to dissolve large parts of the pandemic response team. I'm telling you, it's like they're just like, okay, eyes closed, fingers crossed, toes crossed. Okay, it's going to be fine. It's going to be fine. It's like, oh, fuck. Oh, my, that's what's going on here. Literally nothing about the situation suggests that they should have been dissolving large parts of the pandemic response team. This is magical thinking that maybe if we stop looking at it, it'll go away. All right, so large parts of the pandemic response team, which has more than 1,500 staffers, and reassign members to their original posts. The COVID-19 work would have continued, but the pace would have allowed officials to return to a more normal work schedule. Walensky and her team shelved the plan with the emergence of Omicron. Yeah, I would think so, as cases began to tick up across the U.S. Now, some officials said morale is low at the CDC, as a feeling of helplessness pervades the staff. You think? And again, I would love to talk to people who were at the CDC and quit over these policies, if there is a single one who wasn't so much of a coward that they went along with these policies. I would love to talk about that because I can't imagine how morale ever would have been high. The U.S. has been failing at every step, aside from that initial shutdown, like in the first few months, has been failing at every step because they keep caving to capital at one level or another, whether it was reopening too soon and then we get a huge spike, whatever it is, they keep caving. Continuing, that raises questions about Walensky's ability to usher the agency and Americans through the Omicron wave into a year that could bring new rounds of vaccinations and more infectious variants. Quote, "There's no end in sight," a second CDC official told Politico. "We're all tired." Commenting again, as far as the new rounds of vaccinations and more infectious variants, so the vaccines, like I said, get them. They help to reduce your probability of getting the worst symptoms. But there are a number of countries reducing the booster time, the booster interval, from 6 months to 5 or 4 months. Then what? 2 months? Like, get a daily booster shot? It's just not enough. We need to do something else. You can't have herd immunity plus vaccines as your strategy. It doesn't work like that. We know that Omicron is more evasive of the existing kind of immunities that we have going on. And at some point, you just need to say, okay, we have to stop the spread. Because Omicron spreads so fast, and every time that the virus spreads, it replicates itself. That's by definition. And every time that a virus replicates, there's the possibility of mutation. So with Omicron just jumping from host to host and rapidly mutating, you've just significantly increased the odds of another variant emerging. So at some point, you just have to stop spread, and you can't just focus on symptoms. Continuing. This story is based on interviews with 9 current and former CDC officials, all of whom served on the pandemic response team and worked on critical COVID-19 investigations, and 4 other federal health officials who coordinate with the agency's leadership. 6 were granted anonymity to speak freely about the working conditions in the agency. Current and former officials of the CDC said employees on the response team, officials, and scientists from several CDC offices have for months told their superiors that they're exhausted and need time off the team. Some staff members have worked on the team since the pandemic began, while others have rotated on and off the response team in 3 and 6 month intervals. They work as many as 214-hour days a year, including weekends. Just a quick comment there. Clearly, this whole article is trying to set it up of like how punished this team is. I just want to point out, if you divide 200 by 365, it comes out to 55% if you round up. So then if you multiply that by 7, as in 7 days a week, you get 3-something days per week, or about 53.7 hours. So that's as many as that. Now, definitely 54 hours a week is a lot. Just wanted to put that in somewhat greater perspective here, or at least better perspective, because 214-hour days a year may not mean that much at first glance. All right, continuing. Officials describe the response team as generally supportive and say that managers of the team's task forces try to allow employees time off for holidays and family gatherings. In a press briefing last week, Walensky acknowledged that officials on the CDC response team are burned out, and said that she hopes to rotate members onto the team to lighten the load on those who have served for more than a year. Quote, "This has been a hard several years for the people of this agency. They're tired," Walensky said. "I have been working hard to ensure that people have adequate time away, that we are rotating people through the response, and that we are providing data in real time, but only the data that are needed in real time so that people can actually take the time that they need," unquote. Henry Walk, the former leader of the pandemic response who recently left the team to become the agency's director of the Center for Preparedness and Response and to focus on testing, was also on the call with reporters last week and said that now is the time for CDC employees to, quote, lean in. In an interview with Politico, Walk said the pandemic response team has a specific group that is dedicated to checking in with members of the team to help to mitigate burnout. Quote, "It's the science around this and trying to understand how to mitigate the transmission. I think we've been challenged in trying to keep ahead of the science and keep ahead of the virus. And that does cause a lot of late nights and long days and missed holidays," Walk said. "But it is not like this is the first response we've ever been involved in. I think we know what we signed up for." Growing frustration in the pandemic response. In the early days of COVID-19's spread in the U.S., the CDC pulled thousands of officials and scientists from agency offices to form a team to help the Trump White House respond. Led by then-Director Robert Redfield and Walk, the agency focused on gathering global data as well as information from state health departments to track the spread of the virus and help contain it. The team also facilitated nationwide investigations into large-scale outbreaks to understand the risks the virus posed to both the masked and the unmasked, and it expanded its mortality analysis, determining which populations were most at risk from COVID-19. The first signs of burnout and frustration on the pandemic response team bubbled up in the spring of 2020, just months after the virus first emerged in the U.S. Quote, "In 2020, my average day was somewhere between 12 and 14 hours. That's including on the weekends. There were a lot of long days," said Aaron Sauber-Schatz, who served as lead for Community Interventions and Critical Populations Task Force on the response team. Quote, "One of the biggest pushes was before school started up again in 2020 and getting the school guidance ready. We were thinking through every sort of scenario that would help keep our kids as safe as possible," unquote. With a White House then focused on a federal response that relied largely on the advice of individuals with no experience working on infectious diseases, it became increasingly difficult for the response team to make an impact, according to 2 CDC officials. Officials described months of long days working on COVID-19 investigations, analyzing incoming data, and compiling reports to present to the White House Coronavirus Task Force, only to have the White House promote policies that did not align with the science. In one instance, in July 2020, the CDC issued reopening guidelines for schools, advocating that districts implement strict mask wearing and social distancing. Then President Donald Trump blasted the CDC, quote, "I disagree with the at cdc.gov on their very tough and expensive guidelines for opening schools. While they want them open, they're asking schools to do very impractical things," Trump wrote on Twitter, pushing back against the agency's recommendations. So just commenting here again, definitely Trump did some heinous things, like I believe telling Florida not to report their deaths to the CDC. It seems like now, though, we have a situation where the White House isn't fighting with the CDC, but also the CDC is way watering down their recommendations. So what's going on? Quote, "There are times where we have conversations and it's very clear that people just simply did not read the guidance or did not read the science briefs that support the guidance," Sauberschatz said. "We have a web page that we started basically doing literature reviews, a summation of pulling all those pieces of information, not only from the US, but globally, to provide a summary that is understandable, relatively brief, but that also shows the support for the guidance that's out there," unquote. As Trump continued to criticize the CDC and sideline top officials in the agency, staff on the pandemic response team worked to try and mitigate the spread of the virus by working with state public health departments to improve their data collection methods. Latrice Harris worked on the response for 20 months and led a group that created a method for collecting and reporting vaccination data. Her team had to build a process through which states could collect patient and immunization data. Some state health departments did not have the legal authority to collect and share that information with the federal government. Quote, "That was an extremely arduous task because of the fact that all the immunization jurisdictions in this country, they actually operate as separate entities," Harris said. "They're all really focused on collecting data for their state, but not necessarily representing that information or sending that information to any type of national reservoir. It took a lot of work with the jurisdictions, a lot of work and trust building," unquote. Still, the CDC was criticized for moving too slowly on its COVID-19 investigations and scientific analysis. Behind the scenes, Trump officials in the White House and at the Department of Health and Human Services claimed that the agency was too bureaucratic and academically minded for a pandemic that required health agencies to respond quickly to evolving science. Quote, "The temptation, if you're politically minded, is to blame Bob Redfield, who was, I think, by all means a disastrous CDC director," said Ashish Jha, dean of Brown University's School of Public Health. Quote, "But the CDC's problems go well beyond Bob Redfield. The previous leadership had not done enough to get the organization in good shape. So Dr. Walensky inherited a really messy organization with some real strengths, but also a lot of problems," unquote. So I gotta say, this article is getting really mushy. Who the fuck cares? Like, where are they going with this? I mean, this article said that the CDC almost dismantled their pandemic task force early in the article, and now is just sort of, I don't know, apologizing for it. Like, where is all this going? It just doesn't seem that interesting or really relevant to where do we go from here in a recently renewed pandemic? Like, what is the next step and how does the CDC factor in? So the next section is titled "A New Era for the CDC," continuing. 4 current and former CDC officials who worked alongside the pandemic response team said that they hoped the election of President Joe Biden would clear the way for a more integrated federal response to COVID-19, one that would put the CDC and its response team back at the forefront of the conversation. When Walensky became director, she vowed to rebuild the CDC by promoting its work and streamlining inefficient practices. But over the last year, the CDC has struggled to move above the political fray as its COVID-19 guidelines led to confusion and frustration. The criticism lobbed at the agency over its handling of the booster debate and its communication on its isolation and quarantine rules has deepened low morale at the CDC. Multiple officials who have worked with the response team said that they've become increasingly frustrated with the CDC's communication strategy on COVID-19, particularly its messaging on masks, boosters, and transmission of the virus. Comment there, I think that this goes beyond, a communication strategy. I think that what they're saying is a lot of times just bad advice, pure and simple. Continuing. This fall, following weeks of debate, the CDC's advisory committee voted not to endorse a broad booster campaign, instead advocating that boosters be given to people 65 and older and people 18 to 64 with chronic health conditions. The panel said there were not enough data to recommend boosters for everyone. Walensky went against her own advisors, recommending that frontline and healthcare workers would also be eligible for the boost. The decision sparked confusion as to what science Walensky was using to support her decision. Weeks later, the agency published several vaccine efficacy studies that showed the extent to which boosters could help to protect Americans. Quote, "The organization is still too bureaucratic, its tools still too slow. And the problem is, in a pandemic, when policy changes need to be made quickly, an organization that's too slow feels irrelevant," Jha said. And to the extent that it feels irrelevant, it undermines people's confidence in the organization. Now, commenting, I think that they're just kind of tiptoeing around a lot of stuff here. It's like they're mentioning topics without really delving into them. We're getting near to the end of the article, but continuing. In another confusing messaging episode, the CDC last month shortened the recommended time period that Americans who contracted COVID-19 or who are exposed to the virus from 10 days to 5 as long as they wear a mask. The move led to an uproar among public health officials and physicians who questioned why the CDC did not recommend that Americans receive a negative test before leaving isolation and quarantine. Comment, in the UK, for example, you have to test negative twice. So that's sort of like a glaring omission. It wasn't until days later that the agency added a scientific rationale to its guidelines webpage, a long memo that detailed how the CDC came to its recommendation. Quote, "I feel like one of the most important tools of public health is communication with the public and explaining the why," said Celine Gounder, an infectious disease specialist who advised the Biden's transition COVID-19 response. Quote, "This isn't just the CDC. Our government is stuck in this very outmoded, sort of antiquated approach, which is more about public relations than it is about real communication and education," unquote. So I would fully agree there, and see our recent video on Jeff Zients, the Biden COVID-19 response czar, basically the head of the COVID team for Biden. And he's from Bain Capital. This is not somebody who knows anything about public health, and that's who's kind of making a lot of the political decisions. Treading water. Interagency fatigue escalated this summer when the Delta variant began advancing across the country, according to interviews with two of the CDC officials who said that the response team came under intense pressure to produce work quickly, sometimes before it was ready to align with White House priorities. Scientists moved to complete two massive projects at once, tracking breakthrough infections and investigating vaccine effectiveness. So comment, they're about to talk about Israel and the UK and that whole conversation, but let's talk for a minute about the political priorities of the Biden White House. It was running the Back to Normal campaign. It was Biden had campaigned on, "I'm going to shut down the virus, not the country." Well, you kind of have to do the one to do the other, actually. And specifically, Biden had the goal of 70% vaccination of the United States by July, or 4th of July. That's what it was. Independence Day. Well, I was going to say July 1st, but no, it was Independence Day. So they didn't get anywhere near that. It was closer to like 50%. And nevertheless, Biden announced that they had conquered COVID. It was like insane. And they had also announced that if you had been vaccinated, you could take your mask off. This was, it just actually completely flew in the face of everything that we know about how COVID is transmitted. Yes, after the first week, people have been vaccinated or have natural immunity, will have lower viral loads because the body is fighting off the virus more quickly. So the viral load drops. But in the first few days, like 5 or 6 days, viral load's comparable. So you're just as contagious as anybody else. So you have Biden as part of a political party which had kind of won on a wave of anti-Trump sentiment and basically just saying, we won despite lack of support from the left, and we don't necessarily need to make any concessions to the left, etc. So what didn't happen? $15 minimum wage didn't happen. Public option, which Biden campaigned on, or at least it was on his website, that didn't happen. Build Back Better got cut down from 10 trillion to like an eighth of that, and the fight goes on for anything resembling any type of an agenda. But Biden running on this back to normal, we got to get, we got to inspire dignity and all this stuff again after Trump. And what's happening? Things are not good. And of course, the Delta wave started to pick up. And with it, here I'm going to put on the screen, Biden's approval rating has not been good. And I would say that it's really starts to decline around the same time that Delta was picking up this summer. That could be a coincidence, but yeah, I don't think so. You can also see there, like Biden's approval around Christmas goes up slightly. I think that people were maybe like, oh, are they going to do something about Omicron, which of course was big news then. And then of course they really didn't. And of course, line go down some more after that. So you have a really unpopular president who's kind of desperate for, improving the numbers somehow or making the situation look better than it is without actually doing anything constructive, because they're completely beholden to the 1% who clearly are just locked onto this no concessions path. Anyway, let's continue. Data from Israel and the UK suggested that the vaccine's effectiveness was beginning to wane, and that fully vaccinated elderly individuals who contracted COVID were increasingly seeking medical attention at hospitals. Comment again. So this gave credence to the kind of anti-vaxxer thing where they're like, oh, look, the vaccine's making people get COVID. Like they would say any kind of crazy spin. Of course, the vaccine was not making people get COVID. It's just that the coverage would wane after like 6 or 8 months, and you'd be back down to like 30% protection. That's not good. And I've got to say, as we need like better, the vaccine, get it, it's good for what it is. We really need something better. This isn't, it's very temporary coverage. And I think that this just opens the door to renewed problems like multiple times a year, more or less. The communications actually have been a disaster, even getting those basic points across to a population that has been extremely vaccine hesitant for a number of reasons. Some founded like general mistrust of government, not wanting to be experimented on from vulnerable populations who had been for, centuries, to, less founded like, oh, the Rockefellers put a microchip in it kind of stuff. Anyway, let's continue. The international data prompted conversations in the Biden administration about the possibility that Americans would soon need booster shots, a top Biden health official said. The White House COVID-19 task force turned to the CDC, requesting the agency quickly complete its analysis so the administration could decide whether to recommend boosters and to whom. Top Biden health officials, including Anthony Fauci, the president's chief medical officer, advocated that the administration should conduct a broad booster campaign, and the White House set a deadline for late September for the rollout. Walensky defended the CDC, telling White House officials that the late September booster target was likely too ambitious, and that the agency had not yet completed studies that would help to provide the rationale for the shots. As the booster campaign began to roll out, scientists on the response team hoped that they would be able to find some reprieve, that cases would begin to come down. Then came Omicron. The CDC's burnout dilemma comes as the country is facing an onslaught of new COVID-19 cases and hospitalizations. Although more than 60% of the country is fully vaccinated, the U.S. continues to report record numbers of breakthrough infections, in part because the booster campaign has moved slowly, top Biden health officials have said. Comment, I don't think that that's why. Okay, we know that the booster helps, but it's far from bulletproof. I have read many, admittedly anecdotal, reports of people getting the booster and then still getting knocked on their ass for 2 weeks with severe fever and pain and all kinds of stuff from, a very intense bout of acute initial COVID infection. Then, of course, there's long COVID after that. So the booster helps, but how much? And how many doses do you need? Like four? I was seeing something that I saw in passing where it was like you need the fourth dose to really get significant additional protection. At which point it's like this alone is just not a strategy. You've got to stop spread. But, of course, it's super easy for the Biden team to just sit back and be like, look at these, ungrateful people. They're just not getting the shots. I mean, okay, get the shots, but also fucking you command political power, do something. The Omicron wave seems to have pushed the pandemic response team to the brink, also the healthcare system. One CDC official on the response team said that they have worked as intensely now as they did when the pandemic first began, saying team members are still required to fulfill work for their roles outside of the response team as well. Yeah, and commenting on that, I think a lot of people feel like we're back to the beginning of the pandemic, only now they're like taking shutdowns and monthly payments off the table. Fuck. I don't know, what else can you say? Like, fuck, stop, like, do something else, please. But of course, no matter how many times we say please, they're not going to. This is why mass demonstrations, walkouts, protests, we have to bring it to a halt. They're just not going to listen otherwise. Meanwhile, Walensky and her top lieutenants do not require officials with experience working with infectious diseases, data analysis, or field work, for example, to put in time on the response team. Instead, they have relied on employees volunteering. Comment, this is sounding a lot like the hospital situations. Or going back to an earlier COVID video where some of the New York City emergency crews were using like desk staff on the front lines. It's like, you put that pencil down, get on the truck. It's like, I'm not trained for this. Anyway, quote, a lot of people don't want to come and work on the team because they know how much work it is, the CDC official said. Sauberschatz said that some of the individuals who have not worked on the response team picked up extra work that those serving on the response can't get to. Quote, that's part of the way that we've made this sustainable, she said. Walk told Politico some employees working on the response have been moved off the team back to their normal offices because their work is either not crucial to this stage of the pandemic or because it overlaps with what others in the group are already doing. In the press briefing last week, Walensky said that she has tried to reduce the workload of the response team by, for instance, pushing employees to provide real-time data only when absolutely necessary. But the agency has no current plans to formally reorganize its response team. Quote, the CDC is just treading water. They're just trying to control the next crisis, not even being able to anticipate what that is, Gounder said. Quote, whether it's the CDC or the White House COVID response team, they're just completely maxed out and just trying to keep up with what they're trying to do right now, unquote. That's the end of the article. And honestly, if I was editing this article, there was a whole lot of generalizations that just sort of add filler without really saying much. But that last part, I mean, for fuck's sake, as your research question, dig into that. The CDC is just treading water. They're just trying to control the next crisis, not even being able to anticipate what that is. They're just completely maxed out right now. Well, first of all, why are they so maxed out? Maybe it's because they keep trying to pretend that they can wish this thing away. Look at China. They will build a hospital in 5 days that has 6,000 rooms. They are actually taking care of this thing. They will shut down a whole section of a city and control an outbreak there rather than letting, just millions of people in the population get infected with a virus that stays in your brain for potentially months after infection. They don't want that. The US is trying to do this laissez-faire, hands-off approach, and it's not fucking working. You do not control highly infectious disease outbreaks by just letting everyone get infected. That's literally the opposite, and it's how you get new variants. And this is elementary, but as far as the CDC just treading water, just trying to put out fires, they don't know what's coming down the line. They're maxed out. They're not in charge at all. They're just trying to react to what's happening. That's, I think, where we're at. Combine this with the Jeff Zients article. Combine this with them not doing a mask mandate. I may do a video on that later. they can thank their own fucked up policy for this situation. And I guess that's, if I could reframe this article, it's like, CDC crushed by the consequences of their own actions. That's basically what's going on. If you want different outcomes here, if you don't want your staff to be completely crushed by this workflow, try doing something effective. Try actually shutting down the virus, as Biden said, which, yeah, may involve shutting down the country and with a real lockdown. But this may be the end of the U.S. system. I mean, honestly, if this presses on for another few years, which, unless the virus somehow disappears, this is clearly putting stress on the United States that it can't seem to handle. Even if a few states refuse to lock down, they wind up like becoming incubators of the thing. And then when things reopen, boom, just all that virus goes into the other states. This system isn't handling this crisis at all. And unfortunately, I think that this article could have been a bit better written and, it could have maybe dug more critically into some of what it was analyzing. Nevertheless, I mean, for the few really kind of razor sharp quotes in there, like that the CDC was about to fucking dismantle its task force right before Omicron hit. Like, are you insane? Why did they follow up on that more? Or, this last one about the CDC is barely keeping up, just barely treading water. I mean, it was worth the read, but let's just say I have more questions. Anyway, what about you? Do you have questions? What are your thoughts? Leave them in the comment section below. We'll continue the discussion. As always, it's always an interesting time. Otherwise, I'm going to sign out. So thanks for listening. Thanks to the current patrons whose names are on the screen. If you'd like to get your name on the screen, head to patreon.com/socialism for all. You can sign up for as little as $2 a month. Every donation is encouraging. They're also materially helpful, so thank you very much for those. If you'd like to help out without making a donation, click like, subscribe, leave a comment, even if it's just good video or thanks. All of that helps to boost the video and the channel in the algorithm and helps more people to see this content, as does sharing it on your social media, which can, of course, reach out to whole new audiences, and that is very important. So thank you for doing those. The channel has been growing, and it is due in large part to your contributions, so much appreciated. Also, back in the real world, join an organization, or at least consider a donation to one. We need more organizations so that when it comes time for mass actions, rallies, demonstrations, strikes, whatever, we have organizations that can mobilize people to do that. And as a bunch of fragmented individuals, that is less the case. So look for something in your area that's doing the kind of work that you'd like to support, and check that it's a healthy organization, maybe by contacting them, seeing how quickly they respond, how often they have meetings, things like that. Sometimes an organization can look great on paper, but be a completely dysfunctional mess in reality. So you don't want to get involved with that. It can be a big drain on your life. And besides, there are better organizations. You can only do one thing in a day. Use the time well, I guess is what I'm saying. Or you can start a project of your own. If you have the idea, the resources, and the comrades to get it going. We love hearing about new projects starting up, so good news is always appreciated, and it is up to us. All right, I'm going to leave it there. Thanks again, and we will catch you in the next video.